Welcome back to another video of incentives and perspectives. So what we're going to be talking about today is the US healthcare system and more broadly, why are we seeing Americans at the highest rates of just being sick, obese, dying from chronic preventable diseases? Why do we see this right now? And I'm going to go through a lot of different factors, as well as I think a lot of factors that you might not even be considering currently that I think are leading to this kind of systemic issue that we are having. And I'm going to explain, I think, one of the reasons why it's going to be so difficult to change this, because there's some aspects of it that can be changed on the individual level, but there are certain societal-wide systemic aspects of it that are not going to be able to change at all. Just like with a realistic kind of view. So we can first think about like how stuff has started out, right? I did a book review on kind of how surgery started, and you'll start to understand that the whole system was semi-intentionally designed, but there wasn't a lot of revision. And this is what happens with a lot of different industries, is they start out in a certain way, and the people at the beginning of the industry, so for example for medicine, at the beginning there was a lot of gaps in medical knowledge and understanding of health, and it was a very kind of one-sided view. It was very simple, and so this was kind of the approach that led to the creation of the first medical school, as well as just the kind of creation of the healthcare system, right? So we'll keep that in the back of our mind, because what happens is a lot of these industries, they just don't change, and over time, as more information comes out, you need to change, because new information suggests that you should be doing something else to keep people healthy. And so when you can't change, that's already a red flag that there's going to be a disconnect between what the current state of things are and what they should be based off of current knowledge and what we can achieve. And so that gap is just going to keep widening and widening as a industry gets more and more stuck in the past. So okay, if we kind of look at healthcare system, we're going to first focus in on the kind of hospital system, right? So we have hospitals, right? We also have doctors. So you know how I like to do, we're going to start with all the kind of involved stakeholders and people, right? So hospitals, doctors, we also have insurance companies. And then we also have drug companies, right? So this is the main trifecta. Of course, there's also going to be the side of food companies and health and that kind of aspect of it, although I don't think I'm going to go into that right now. I'll probably let me just put that on the second page here. So let's say food, industry, something like that, right? Oh, and then also I forgot to mention there should be government here, right? So okay, if you've been watching my other videos, you know that this is definitely much more complicated, right, than some of the other things we've dealt with, because in other situations we've identified only a couple major players in the kind of system, right, and people that have, let's say, interests in a certain outcome, or people that wield enormous power over the system. And in this case, right, we're looking at this diagram, we got five major ones. Obviously there could be some more, but I think these are the most important ones to consider, right? So if we think about this, let's always start with kind of the I guess one other thing we could talk about is the individual receiving health, right? So we could think about the patient as well. So you just see how complicated this can get. But let's just start with actually doctors, okay? We'll start with patients, because usually we like to start with the consumer, and we'll note what are their kind of limitations, right? So the biggest limitation here is patients just have no idea, right? So lack of information. They have no idea what they should do for their health. Yes, they receive certain guidelines from the government about let's say diet and exercise, but these are very broad, very generalized, and what you're seeing is that there is a huge disconnect with each person's individual lifestyle and their unique behaviors. So for example, they may be suited to doing a different kind of physical activity, but there's no guidance on that kind of determination. The government just says do physical activity, eat healthy, right? Eat these fruits and vegetables. But it doesn't say which fruit and vegetables for each person that may be more convenient for them, that would allow them to actually stick to this routine. And so I think this, in a sense, is kind of contributing to this culture where you have a lot of fad diets, people, currently going viral about talking about seed oils or alternative things. You're hyper fixating pretty much on getting a really quick fix. That's the whole idea. And whether it be, low carb, low fat, keto, fasting, or you just have all these different approaches, right, to health. And to be honest, for each individual, yes, there are multiple approaches that you could take, but it's much simpler if somebody were to just give them a kind of straightforward that thing that applies to them specifically. But the problem is the government can't do that because everybody's so different. So we'll come back to this idea that patients are highly unique, right? So what is going to work in certain cases is not going to work in other cases, right? So that's why like people need to really understand this, and the medical system needs to understand this, but unfortunately the medical system is not really like good at understanding this, right? Because they're just trying to do a different approach where we have it be like, oh, like it's a one size fits all approach, and you know everybody's kind of the same, nobody's different, but that's not really what we want, right? So if we go ahead and kind of look at the next people here, right, we're going to take a look at kind of doctors, right? So just for the patient side, lack of information, highly unique. We can also say vulnerable, also price sensitive, right? They don't have a lot of money, right? So even though they're spending quite a bit, right, in the sense of like, if you think about, so what we have is the insurance systems, and we'll get into how those work later, but with insurance and stuff, in a sense, you're given leverage. That's what you're given. You're paying this kind of monthly fee, and the promise is like, hey, if I get really sick, and because everything in the U.S. is so expensive, right? If I get really sick, then I need you to pay for kind of my medical bills and stuff, right? So, but otherwise, right? Because there's no way this individual person could pay like, let's say, hundreds of thousands of dollars for medical bills. So they're very price sensitive, right? If for some reason they have multiple hospital visits and they run out of their kind of insurance credit, the amount of that money that's the insurance is going to actually cover for them, right? Then they're going to be screwed. There's not going to be like a situation where they can just, I can figure out something else and just pay out of pocket. Like that's not the reality for majority of people. So this is also hinging on the fact, right? I didn't really talk about this in like the starting of this video, but obviously the U.S. healthcare system is just exorbitantly expensive, right? That's a problem. And compared to other countries, it's not like we're paying more and we're getting more. We're paying more and we're getting less. Right? We're getting less output actually for the amount of money that we're putting in. So that in itself really signals that there is like an inefficiency, right? But that's like another kind of thing we'll get to later. Okay, now if we focus on doctors, right? So doctors are highly educated, that's the idea, right? So they have lots of information. Although we will talk about a little bit about like this kind of information, who is giving them this information. And the information is coming from medical schools. And medical schools, as with all schools, right, a lot of them are not very adaptable in the sense that they're not going to change their curriculum to update with a lot of newer things. They're going to tend to stay with a lot of routines. And this is just medicine in general, right? A lot of doctors will do the same things over and over and over again. And as such, it doesn't adjust very well. So then we can kind of question, okay, we have a lot of doctors and they may be good at a lot of stuff that was, let's say, taught to them before. But the question is, what happens if the stuff that they're being taught is not really relevant or it's not helping? Well, there's not much hope because you would have to have the medical school system revise their educations and like revise their curriculum, which is probably not going to happen, right? Because again, if we look at like incentives, the government has to mandate something. Otherwise, the medical school, they're not just going to willingly change their curriculum completely, right? For like what seems to be like no reason, So doctor is technically very informed, lots of information. However, though, you have to understand that, a lot of times you'll be like, oh, doctors, I think I've heard this a lot. Doctors have so much control over stuff. But in reality, I don't want to say it like this, but it kind of is. They are pawns in a sense. Because in the current way that things are going, right, the way stuff is going, at least in the U.S., is that a lot of doctors can't own private practices because they're getting bought out by either private equity firms or larger hospitals. And so this means that almost all doctors, right, the vast majority are on some sort of contract system where they're literally just like a 9-to-5 employee. And you may be like, this is great, this is fine, doesn't matter. Yeah, except for the problem that like sometimes certain hospitals don't let the doctors really like unionize. And if they do unionize, I'm sure there's some sort of like, adverse kind of reaction by the hospital team. And even with doctors, right, if we look at, okay, they make a lot, but also medical school is very expensive. And so debt is becoming a problem, but there are a lot of, let's say, there are some, and they're not great, but there's some like loan forgiveness programs. But the problem is this is also a trap again. So pretty much they'll say, oh yeah, I'll forgive some of your loans, but you got to work with me at this hospital for the next like 5 to 10 years. And so in a way you become like kind of a slave. And like, I don't use the word slave like in, I guess, the worst manner possible, but the idea is you don't really have that much freedom as you would expect, right? Because you could be stuck in this like semi-toxic job contract, as well as the fact that a lot of times what dictates what you're actually able to prescribe is just based off of insurance, right? And actually comes down from the hospitals. But like I mentioned, the hospitals are kind of controlled by the insurance companies. Why is that? Well, because think about this, right? If you're the insurance company, you're the one actually paying for the medication, right? And you're actually paying that money to the drug company. So if I was paying something to somebody else, right? I don't want them to just, do whatever they want. They got to follow with what I'm doing because I'm actually the one paying for it. And so that's why these insurance companies have a lot more say over the hospitals and the doctors and the kind of things they cover, right? Insurance companies, you can imagine them as like kind of patchwork. Each one will cover a different part, but another one may not cover another one may cover the same part, another one may cover different medications, it may not cover other things. And it really is a business in the sense that insurance companies are very fluid. They won't always cover certain things. They may add things to their coverage. They may remove things from their coverage. Right? One of the big things is like in the space of, let's say, rare diseases. There's a lot of these rare diseases that have treatments that exist, but they're just so expensive. And the people with the rare diseases could be like, let's say 1,000 people in the entirety of the U.S. Right? So for the insurance company, they're like, what's the risk reward of me covering this or not? Right? And they're going to kind of err on the side of probably not covering it because otherwise it's going to be a huge expense and it's only going to benefit like, maybe 1,000 people, and they're out here covering, let's say, hundreds or like tens of millions of people potentially. So this is kind of the situation we're seeing here, where like I think it's very easy from an outside perspective to talk to, let's say, a doctor and just imagine, oh, they must be making so much money, not realizing that they work also a lot of hours, and usually if they're in the hospital, they have to take calls sometimes. And then you'd be like, oh, they can do whatever they want. They should be able to, like just prescribe whatever they want, like give you any drug that's on the market. No, that's not really true. And so now we're going to see why this matters, because we're going to see how the top-down kind of incentive structure and what people at the top want is now affecting the people at the bottom, which you would assume would be very objective. You would want a doctor to be like, oh, I only care about your health. I don't care about anything else. But it's not really true. You still have situations where big pharma companies, drug companies, even like biotech companies are taking out doctors to lunch and paying for their lunches, giving them like nice dinners, giving them like gifts, or like they can't give them like outright just like money, but there's like other ways to do it. And I always talk about this, but there is a study that shows that if you give a doctor a pen that has the name of your medication on it, subconsciously doctor will start prescribing that medication more without even realizing it. And so this is a really big problem, because now if you imagine, okay, if I give them a pen that has the name on it, well, let's say if I go and take them out to a huge lunch that's like really delicious and, they have a great time, and then we talk for a long time and I give them some like other stuff, like that is going to have a huge psychological shift on how they approach their practice and how they approach their patients and things like that, right? And the other thing I like to mention is like, if taking these people out to lunch, if giving them these gifts wasn't working, do you think the insurance companies or the drug companies would still be doing it? No, they wouldn't. So the reason they continue to do this kind of activity is because it works. They've been doing it for the past probably like 50 years, and it works, and that's why they continue to do it. So this is really a big, it puts a big hole in the idea of, doctors being extremely objective. And this is important because this can explain why we started with the idea that doctors are going to help us. And then it can explain why we've drifted so far to this other side, where doctors are now going in a direction that is dictated by incentives from the insurance companies and the drug companies and the hospitals. But in reality, it's mainly just insurance and drug companies which kind of control the hospitals, right? And it's leading them in this direction because the incentives for profit for those companies is going that direction. But those incentives for profit are not aligning with the right way that we would imagine, which would be health for individuals. And this is why we are seeing this situation where prices are going up, right? So drug companies are kind of just demanding really high prices. I'm not going to go into everything, but pretty much when we talked about the food companies, right, we talked about how there's a lot of consolidation, right? There's only a couple companies that kind of own the whole market. There's a very similar thing going on with insurance companies, hospitals, and drug companies, right? Drug companies are a little different, but the idea is there's like only a limited number of insurance companies, and each one, right, is responsible for a vast amount of like insurance and covering people, right? You think about United Healthcare, that's one of the biggest ones, right? And then underneath that, you have hospitals, which are kind of like going to get covered by these insurance companies. And so you also have technically different hospitals, but those hospitals also could be managed by more consolidated companies. So if you think about it, the whole thing I'm trying to say here is we're not dealing with 1,000 different separate kind of entities. No, we're dealing with a couple very large players that own a huge portion of the available care facilities, of the available insurance, right, that cover a lot of people. And as a result, what I've mentioned before is when you consolidate, right, there becomes a very strong incentive and ability to kind of collude and work together and, in a sense, get more profits and create, because you are technically the biggest player in the space, or you are working with the other big players. And so you can work to lobby Congress, lobby the government to change the space or keep it the same way, depending on whether or not you want to like make more money, make less money, and keep the status quo. So this is why, like one example of this is this software called Epic, right? Epic is the software that doctors use to take their notes. And it probably, I don't know exactly when it was created, but let's assume for at least like 20 to 30 years it's been around. And in the 20 to 30 year time frame, this is like a piece of technology, right? It's like a IT, like it's a software. So you would say, oh wow, in 20 to 30 years, right, we've gone from pretty much .com, like internet, to AI. So there should be a huge shift. No, not really. I mean, like right before AI happened, it was not a huge shift. And the problem was it was causing tons and tons of burnout because doctors had to write all these notes, right? And the note-taking process ended up forcing them to kind of work overtime at home because they had to write all these notes. And it became much worse than actually just going and seeing patients. But it was such a required kind of process, and there was no streamlining of it. The software itself, I've used it, is just absolutely horrendous. It's clunky, it's outdated, it has a bunch of weird kind of hard set rules that are just make it just awful. And so like you can look at that as an example of like, that's just one part of the healthcare system. That's just one part, right? We're not even talking about how you bill things, how you file for an insurance claim, how these companies process stuff. Like this is just one part that the doctors tend to see, and it usually has patient information, right? So we can safely, I would say, extrapolate this to other parts of the industry, which, you know, again, we're always working in a state of not having enough information, right? I don't have all-seeing eye. I don't know. I've not worked on any insurance company. I'm not part of a drug company. I've talked to some doctors. I've been in some hospitals, right? So I kind of understand that aspect. But if we want to really understand the scale of the issue, we need to project that and kind of extrapolate it beyond just the specific experience that it is, right, for that Epic software. Okay, now let's talk a little bit about drug companies and government. Okay, so drug companies, it's very expensive to develop some sort of drug because what happens is you have to like meet all the kind of requirements for safety that the government requires, and you need to do a bunch of clinical trials. So you can just imagine, okay, to develop a new drug that works, it requires a lot of money. We're talking like hundreds of millions of dollars. We're talking about like 5 to 10 years, maybe more, maybe less, depending on how stuff goes, right? So you just keep this in mind. And then these drug companies, you have to imagine, are business-minded people in the space. So what is the only kind of way you can rationalize that? Well, when you go to market, right, and you actually finish that whole process that was super long, super costly, you have to charge more. Otherwise, there's no way. And this is how the government incentivizes people to actually make drugs, is that there's this, you can patent the drug, right, and protect it, and therefore you can make money off of it. And then because once you make that drug and you're the first in the space, you can pretty much set whatever price. I think there's some sort of limit, but it's not very like strict. So you can almost set like whatever price. And then the reason why I think it works because like the average individual, because you have to really have health insurance for the most part, they're not going to pay that price directly, right? They always get subsidized. You just do your copay. That's why like I'm able to buy like, you know, epinephrine shots, which are the things if you have an allergic reaction, right? Those things on the market, right? If you were to buy them just straight off the market, no insurance, it costs like $200 for one shot, right? And it's like emergency use. I go to my hospital, I pay a $10 copay, and I pick up like 4 of them, right? That's not possible unless you have the insurance companies, and the drug companies are able to still charge the insurance companies the market like price for that. Of course, there could be some like negotiation stuff that goes on, but that's like behind the scenes. So I think that's part of the reason, because if you charge the individual directly, right, that'd be impossible. And so because of that, I think we've been dancing around this reckoning that should happen. Right? There should be a reckoning of like, hey, everything's getting way too expensive for like no reason, right? But the reason we're not having this reckoning or this moment of realization is because the individual consumer, the patient, is not necessarily directly paying those. Like unless you don't have insurance, which in that case you're just done. It's over. Because if you go to like for ambulance, that's talking about like, $5,000 right there. They give you some drugs and stuff to keep you alive. That's another like charge. And all of a sudden you have people who go to the hospital and they're stuck in debt for the rest of their lives, right? So that's a really scary thing. And that's why you're kind of stuck with insurance. And to be honest, like I will say we're gonna kind of hate on the like healthcare system, but there are certain things that it is good about. And this is what I try to use this framework again and again, right? Nothing is black and white, right? There's a lot of shades of gray in between. So we need to recognize that the current healthcare system is really good at certain things. It's really good at like trauma, surgery, keeping people alive in like very rough, complicated situations, right? We have a lot of great technology. It's very expensive, but it works pretty well for those situations. But the main gripe I have with this kind of system is the actual more general, preventable, like general health trend that we're seeing in stuff that is preventable. That's not like emergency, that's not whatever, right? Because what we're seeing is this kind of model, which in my opinion works very well for emergency care, then being applied to long-term care, where now you have all these medications being pushed. And why are medications being used as the answer to everything? Because in some cases they are the answer, but in a lot of cases, right, the drug companies are doing what I talked about, right? They're kind of subsidizing these doctors. They're trying to encourage them. They're advertising to doctors, right, and saying, use our drug. It's been proved safe, all this stuff. If you need examples, right, you can go back to the opioid epidemic, and it actually started from prescription pills that are being prescribed because the big pharma companies have convinced doctors and medical professionals that pain was like a vital sign that you had to treat for. And if you think about the extent of this is very huge because this literally rewrote the treatment playbook, if you will, right? Because if you think about it, like you're completely rewriting how people approach a patient, what the framework they use for treating it, right? And so if you think about, wow, like I thought medical school was like supposed to be very good for teaching you this kind of stuff, but then if these people, what happens is the doctors get trained under other doctors during medical school, so they may learn something in the classroom, but then if let's say their head doctor is telling them, hey, make sure you treat for pain, then they're going to get that hardwired in their system, and then when they go on their own, they're going to be just doing that. Okay, so there is a layer of like adjustability here, but unfortunately in this situation that I'm talking about, it wasn't adjusted the right way, right? And this led to the prescribing of tons and tons of painkillers, and it was obviously very, very bad. So I think in this kind of situation, we can imagine, and also, okay, so another thing we want to talk about is the relationship between the drug companies and, I don't know why the lights turned off. Okay, drug companies and the government, right, and insurance companies. So if we look back to the food kind of companies and industry that I talked about in my other video, we know that there's direct lobbying going on, right? Lobbying. So if you just imagine this, right? If they're paying money for doctors, right? They're paying money for doctors to prescribe their medications. Of course, they're going to be like paying the like politicians who are in charge of the policies that actually allow them to exist, right? And so this is a big, big hurdle for anybody trying to change the system, is that what they'll do is, if you know what molasses is this like really sticky, like thick kind of substance. And so you can just imagine that what they're trying to do is they're trying to put the whole medical system in molasses. Because why? Because right now they're making so much money. They're very profitable, right? If you imagine you're in a system where you've consolidated a lot of stuff, you have a lot of these weird, opaque rules that have to be followed, and you're already in the space, right? So you want to stop anybody else from entering the space as soon as possible. Like imagine this. Imagine if I was in the middle of a desert and I open up a lemonade stand and I'm selling lemonade and it's really cold and it's really delicious and I get to charge whatever I want. And everybody comes to me. That's great and stuff. But actually one of my biggest priorities is making sure nobody else sets up a lemonade stand, because then I no longer have a monopoly. And then let's say if somebody else does set up a lemonade stand, what I'm going to try to do is I'm trying to work with them and say, hey, hear me out. If we both keep our prices at a certain point, right, you can maybe keep yours a little bit lower than mine, or I can keep mine a little bit lower than yours. But as long as we're pretty much at the same point, right, we're both going to get business, right? Versus if you keep cutting yours, I'm going to have to keep cutting mine, and then we're going to make less and less and less, and it's not going to be good. So this is a very similar situation, right, with what's happening with the drug companies, insurance companies, and the government. And you have to understand how big of a market this is, right? There's so much money in here. So of course they're going to be lobbying these politicians, and then politicians are not going to really change anything because it's not in their interest, right? If somebody is paying you or supporting you or, whatever, right? Why on earth would you go against them if if you go against them, they're just not going to support you anymore. They're going to support somebody else, right? That makes no sense. Also, the other problem, I think, is that healthcare is one of those long-term issues. So, for example, like the current healthcare system, right, I told you in the short-term emergency care, it's doing great. It's actually, saving people who have like gunshot wounds, and the surgeries are great, all this stuff. But just as a long-term health thing, like it's just doing terribly. And what do we notice with the U.S. government when it comes to long-term health things, right? It just does terrible. Like you look at the debt. The debt is a long-term issue, and the reason why we're doing so bad with it is because there's this mantra of kick the can, right? If you think about how you procrastinate maybe on some tasks, right? Well, this is exactly what they're doing. All the politicians know that this is a huge problem that will eventually cripple the U.S. government, right? But they know that in the next maybe 2, 5 years, 10 years, it's not going to blow up. So for them, for their political careers, it's a non-issue. And it also doesn't really affect their voters, their constituents, right? The people in the states who vote for them. It doesn't affect them directly either, right? For you and me, the debt doesn't really affect me right now. It will affect us all if it blows up and we'll just be screwed, right? But otherwise, like, it doesn't affect us. The same thing with healthcare, right? Healthcare long-term trends becoming more and more unhealthy is a very slow, problem. If you can imagine, there's this saying of boiling a frog slowly so that, you just you put a frog in lukewarm water and you start increasing temperature slowly by slowly. The idea is because you do it so slowly, so gradually, the frog eventually just dies, but it doesn't realize it, so it won't jump out, right? Versus if you put the frog in boiling water. I don't know why it's the same. But the point is we're going to slowly progress to the point where everybody's like, oh yeah, the healthcare system's so bad, but it's been like that for a long time. So, there's not going to be a huge point of outcry from the public because there's not been a black and white situation. There's not been healthcare was really good and now it's really bad, right? It's been a very steady, slow decline over time, and this has become unnoticeable to most people. And so as a result, the voters, right, they're not going to bring it up as an issue because it's just going to it's going to take 50 years for them to notice, wow, everybody's just dying around me, right? And nobody's doing well, and why are all the other countries they're spending less than us but they're actually doing better, right? All these things. So that's a kind of political reason why there's not a lot of political support to actually overturn the system. Now, of course, in more recent times with people like RFK Jr. and stuff, you do have this kind of wave of change that's trying to get through. I'll just say right now, they're doing great, but it's going to be very limited because I said the entrenched people they have so much power because they have a lot of money, they own a lot of the entire space. So they're not going to just give up their kind of space, right? And the only way in these situations to really change the entire industry is to have some, let's say, startup or somebody, right, with a different idea of medicine kind of approach this scene. And so if we look at, let's say, startups in general, right? I know we're going on a little bit of tangent, but it's going to be relevant. Software startups are really successful because they don't require a lot of capital, right? So if I say I want to make my own kind of hospital that operates differently, do you know how many barriers there are to me right now to do that? One, I need a ton of money. Okay, let's forget the money problem. Let's say I have all the money in the world. Second, I need to build a bunch of these hospitals. Oh, wait, before I even build them, I need to get the permits. I need to make sure, I need to get registered, but as a proper entity. I need to get all these certifications. I need to become legit. So at any stage of this process, right, it's going to take forever. And then if it takes forever, right, then all the other people, all the other hospitals, wait a second, this guy said he can make a different kind of hospital that's supposed to do a lot of different stuff, right? And then they're going to start all these lawsuits against me because I'm trying to undermine their business model. And they're going to say, oh, wait, he doesn't have certain licensing. They need to have insurance, so I would have to somehow team up with an insurance company, which is most unlikely, right? He doesn't have insurance, you can't practice, this is illegal, all this stuff. And maybe they stop my hospital business from even starting, right? So you have to understand just the scale, the monstrosity of the obstacles and the barriers to kind of getting started. And this is why we have not seen a lot of disruption in the space. We have not seen a lot of overthrowing of these incumbents because it's just not really possible at the same level, right? You'd have to do it in a more direct-to-consumer way, which is more complicated with health anyway. So I think with this kind of idea, we can get a pretty good, with this kind of framework, we can get a pretty good idea of what the current situation is, right, and why. And then now we can talk more specifically about how doctors get paid, right? So doctors are paid in one of two ways, but predominantly in this model called fee for service. So the idea is that they'll get paid for doing a certain service, right? And if you just think about this, right? So let me say let me ask you this. If I paid you every time you wrote the word like happy, right, on a whiteboard or something like behind me, right? If you wrote the word happy, I said, here's $5. What's your incentive? Your incentive is to write the word happy as many times as you can all over the whiteboard, as like much as you can until your arm falls off, because you're going to get like $1 million, right? Well, if you think about it for the doctor, they're pretty much saying, hey, I'm paying you to do some procedure on a patient. So what's the incentive? Do more procedures. Does that mean people are healthier? No. Like you would assume that, oh, I only should do a procedure if they're sick. But then the question of what does sick mean? Does sick mean they're dying? Does sick mean that they're slightly unhealthy? Does sick mean that they're going to die in like 10 years, 40 years? Like how much prevention do I do with this procedure? And how many, so like the incentives can really push doctors to do a lot of more unnecessary things, get more unnecessary tests like MRI scans, those kind of things are often overprescribed. Then there's also another issue where a lot of times patients will come in and they'll have like a low level of trust for the doctor, and also the fact that, okay, it's not only a low level of trust, but also there's medical malpractice lawsuits where pretty much any patient can just sue any doctor for any reason. So in the back of the head, the doctor is like, hey, I want to make sure that if stuff goes wrong and it wasn't really due to me, that I have evidence that I did everything I could. So it's pushing doctors to say, hey, in both cases, you have two incentives. One, if you want to make more money, you should do more procedures. Two, if you want to protect your bottom line and make sure people can't sue you in the future, you want to do more tests and more procedures, right? And so in that case, you're going to have a total shift towards more and more expensive stuff, because now each patient who comes in is going to be like just pushed to do more tests because the doctor has these kind of incentives, right? And that's going to drive overall costs up, which is exactly what we're seeing. The second model is called capitation. Okay, I'm going to drink some water really quick. Capitation is the opposite. It's like, hey, I'm going to pay you doctors, let's say $100,000 or something for this month, but you're not going to get any more money. So you have to deal with all your patients and stuff, and whatever it's going to cost, that comes out of the $100,000. If you run out of money, you run out of money. That's it. So now what is the incentive? Now it's different. Like now imagine if, I don't know how to really describe this, but it's like if I gave you, $100 and I told you, okay, with this $100, I need you to make like 10 tables or something like that, right? Versus like I said, hey, I need you to make 10 tables, but I'm giving you unlimited money, right, for making the tables, and you'll get like reimbursed, right? So in that case, if you're to make the 10 tables with unlimited money, you would make them the nicest tables, right? You would like use all these kind of unnecessary things because you're just gonna get paid back for it anyway, right? But if I only give you $100 and I say, hey, make 10 tables, you're gonna have to work with whatever you have and find the most efficient, so this is the most important part, most efficient way to do it. And this is really why we haven't had any efficiency in our entire system, because there are ways to make sure patients, don't become problems. Like this is another issue, right? So we talked about how the government, how everybody delays and discounts future events from happening, right? So the government's like, hey, big debt, we're gonna worry about that later. Like people are like, oh, this is gonna make you unhealthy in a long time, we'll worry about that later, right? So what this does is it makes that a bigger problem, because you're like, wait a second, like if they come back, let's say in the future with type 2 diabetes, I'm going to have to give them some medication. I'm going to have to pay for that medication out of my $100,000, right? And I don't want to do that, right? And so as a result of that, I'm going to make sure they don't get diabetes first. And then I'm going to be more proactive and say, hey, can you make sure you exercise? Can you do this? Can you do this? I'm going to really push them, because there's an incentive for me for them not to actually get diabetes. And so this has been shown to be much more effective. But the only reason it's catching on now is kind of because it's getting too expensive to the point where I think insurance companies and hospitals, right, it's like costing those businesses too much. And so they're actually looking for a cost-saving way, and then they realize this is a cost-saving way. So this just shows you how kind of messed up it is, because it's not really about, they didn't really consider, this will make them, make patients much more healthy. No, they actually thought about, hey, this is how we're going to save more money and do more with less resources. And therefore, that's why we're seeing this kind of get more popular. But it's still not necessarily the dominant model. And the other problem is, there's so much infrastructure for billing and all this other stuff, right, that's surrounded, that's just based off the fact of this fee-for-service model. And so you can just see how this fee-for-service incentive was built, let's say, at least decades ago. And now it's causing a lot of issues. Okay, that's kind of the big issue, right, with it. Let's go ahead and scroll down here to, before we talk about food industry, I actually want to talk about the part that I said that I didn't think any of you guys were going to understand, which is design. So if we think about this, the concept of a blue zone is where people are living over 100, right? So there's people who do some documentaries on it, people who write some books on it. And pretty much what they're saying is like in these different areas of the world, there's a lot of commonalities, right? Pretty much you see people are in different communities, they're like spending more time together, they're walking more, they're not driving everywhere, they're growing food, right? Those are like pretty much the main commonalities, okay? And that's why they're growing their own food, they're eating that, they're eating pretty healthy, and that's why they're living just for so long. If we look at the very foundation of how America was created in the sense of design, right? If we look at, let's say, urban design, how are suburbs created, right? We're not going to focus on cities, but how are suburbs created? Also, individualistic American nature, and why is there no public transportation that's effective? What's going on with that? And if we look at that, right, if you look at suburban sprawl, what do we see? We see a unit, right? We see one house unit, which is kind of like saying, okay, this is like, you know, my front yard, this is my house, this is my backyard, okay? And there's my car on the driveway, right? And so this is like house, this is front yard, backyard. And then we just replicate this times like 100,000 million, whatever, right? So you just see the same unit again and again and again. And what do we see? It's very individualized, right? Each person has their own place. Each person has their own car. And from their car, they commute long distances. And so we're at a situation now where this is what I'm arguing is the thing that we cannot change. We have created heavy incentives for people to stay seated for most of their days, most of their lives, right? You're driving your car, you're going to be seated, right? The distance is unrealistic to expect people to bike, right? Are you going to really bike like 5 miles to work, 10 miles to work in the morning? No, you're not going to, right? Like that's just unrealistic. Versus other countries that have, let's say, public transportation systems, then is kind of causing you to have a reason to at least walk maybe a half a mile or walk like 200 feet to get to the train station, use the train, and maybe stand on the train, not only sit there, right? And then walk around, walk back. Like there's all that walking, it would contribute to just a baseline level of exercise that we're just not getting as Americans, right? So we're seeing this, and we're also seeing, right, the individualistic nature of Americans, the idea that we don't really share things. If you look at like shared bikes that have kind of been relatively popular in the Bay Area, but it's like it's not really catching on because there's a lot of issues with like crime and stuff like that too. But it's also the idea that Americans don't really like to share things, you know? We don't really like the idea of shared spaces because we have always had our own car, have always had our own house, have always had our own safe space. We've been very individualistic as a society, and this means that we're not going to be really great at sharing some stuff, right? For like public transit and like those kind of things too. And we also just noticed in majority of the country, right, public transit systems just kind of suck. Like maybe in major cities they work, but especially in parts of like Southern California, right, it's completely unreliable. And so what this is incentivizing, this is saying, hey, if you want to actually do anything important, like you want to get someplace on time, you can't use public transportation. So therefore you better buy a car, and that's it. Now we can contrast this with some place like Singapore, where they've obviously, right, so this is some structural part, they're a city, right, so it's going to be easier. They're also more Asian culture where it tends to be more normal for like public transportation to exist and to share things kind of. So they have very good public transportation system, but they've also made a law charging you potentially like, you know, 20,000, 30,000. I'm trying to do the conversion in my head for like how much it is, but apparently it's like 100,000 Singaporean dollars, right? And this whole idea is this is just a tax just to drive. It doesn't mean you get a car, you just have to pay this tax to drive. And so what this is doing is it's forcibly reducing the number of people that drive. And as a result of this, everybody's incentivized to walk, bike, or find another way. But what do we see now? Right? We see areas of the US that have no sidewalks, just roads. So there's no way anybody's going to bike or walk there. We see areas of the US that are extremely dangerous. Singapore has much less crime in comparison, and they're doing a much better job of that, right? And if there's really dangerous areas, you can't expect people to walk at night, right? When it's late, walk during the early mornings either, or just walk in general because it's very dangerous. They're not going to do that. They're going to protect their safety. So as a result of this, right, we've kind of compartmentalized all our exercise and like health routines to going to the gym. And this causes a lot of issues because some people really like the gym, which is great. And so they're going to enjoy doing that activity. Other people hate the gym and like they're not going to do this kind of activity. And I think that as a society, you have to have a couple things. You have to have a plurality of ways to get exercise in if you want a healthy society. But you also need a raised baseline of exercise just for everybody just to exist, right? just going to work, if that requires a certain amount of walking, that's your baseline. You're not going to change that, right? You're not going to try to avoid that. That's just going to be something factored in. And I think that's really where we see the failure in the design of how our cities are designed, how our suburban, like houses and those kind of land plots are designed, because you just see how separated everything is, and you see how it forces you to rely on a car, and there's really no solution to that. Because what are we going to do? Are we going to really tear down all these houses, rebuild everything in a more kind of convenient way? No, we're not going to do that, right? And like if you look at, let's say, a lot more of the West Coast, you'll see that they tend to be healthier. And the reason is, I think that the weather is better. And as a result of the weather being better, people are more inclined to walk, at least if you're like, let's say, some cities create designated bike paths or walking trails. And some people, even though in most cases they're actually the minority, right, will use those to, like, let's say, get to work or do those kind of things. So those things definitely help. But we're not at the stage where we can just put that all over the country, right? Because if it's like snowing, right, people are not going to be biking to work, really. It's like pretty dangerous. So this is really just like, I think, a fundamental limitation of how the entire country is set up. And I think it's one thing that unfortunately we can't do. There's a lot of things that we can do, but this is not going to be something that we can easily change. Now, let's go ahead and talk about the food industry and how this can be kind of tied into it. So food has been a major driver of the issues, because if we look at our kind of food system as a whole, just from, let's say, the farm all the way to kind of our table, we see that the farmers have been pushed to produce huge quantities of food to feed the huge American population. We also have a lot of farmland in the US, so we're really efficient at that, right? So they've scaled that up, made it really, really efficient. Now, the problem is with this too, is it means that, for example, some things like corn have become so cheap that, like, we have too much we have too much supply compared to demand. If you think about like other countries, right? At one point we were trying to sell corn to other countries and they wouldn't buy it because like they just don't need it, and like it's also from us and stuff. And so this just signals why did we make high fructose corn syrup? Well, why do we make it out of corn? Why does not any other things? Because we perfected the production of corn just to such an extent that it actually drove down the price of corn significantly. And so to save the farmers, we needed to find a reason to put into other things and actually use it as an ingredient for other stuff. And this led to the birth of a lot of processed foods and things like that. And let's be realistic, right? It's not, if we talk about accessibility, if you live in the Midwest in a small rural town, the chance that you get like fresh vegetables from your kind of supermarket, right, or that like the proportion of people buying fresh vegetables compared to the amount of processed food that's available there is going to be very bad compared to, let's say, like a Whole Foods in like San Francisco area where everybody's health conscious, and Whole Foods itself does a lot of screening out for like not selling processed foods and things. So that's like night and day. So there is definitely a kind of difference there, right? And if we kind of like approach like that, there's also a lot of cultural and societal norms where in certain pockets of the US, right, everybody's just eating fast food and eating, these kind of things. And if you do anything else, you're going to stand out a lot. And what we know is that there's a lot of groupthink behavior in groups and a lot of social norms and stuff, and people do not want to stand out. So if everybody around you is eating pizza, you're not going to be the guy that's like fighting them all the time and saying, no, I'm going to go get salad. No, I'm going to get salad. You're just not going to do that. So it's driving a lot of conformity into one area. But that's also why we see other areas of the US where people are extremely healthy, because people around them all do these kind of things normally. So I think the biggest thing I want to point to is that this growth of kind of processed foods is part of a point to make us consume more, because otherwise, if you think about it, technically we should have a limit to how much we can consume in a day, right? If you imagine like our food, our satiety, right? We have a stomach that can only expand so much. So it wouldn't make sense. How on earth are we able to consume so many calories? And it's because of the fact that they have perfected the kind of food that makes us want to have more and more and more, so that we can become better consumers, right? You see this with social media. They want you to have more and more and more so that you're on there for longer, they make more money, right? Same thing with this. If you eat more, they make more money. And so that's why that incentives have driven towards a lot of over kind of consumption, and this has led to, decline in our health. And this is also why we're not going to see the reverse happen naturally, right? Yes, we're seeing some groups who are trying to target the health side of the market, but that's more recently. And again, those people will always be a minority compared to the majority, right? And so for the majority of people that are like running these food companies, they're going to protect their profits, which is just something that all businesses do. And as a result of that, they're just going to keep pumping out and trying to make these processed foods very addictive, which they've been very successful at doing. And for them, right, business is a very compartmentalized thing where like you only focus on the things making you money and you don't really worry about any other stuff. Because if there's any health consequences, that's not your fault, right? The consumer has free will, or at least it seems like they do, and they chose to buy your food and they should know the consequences. And then that's where you hand it off to the health insurance companies, the hospitals, the drug companies to fix all the problems, right? So if you notice, like what we're doing is we're kind of creating a bunch of problems that are very complex, and then we're creating a healthcare system that's trying to fix those complex problems. It's like we're just looking at a room, right? There's a huge elephant in the room. An elephant in the room is preventive medicine, and the idea that we can use behavior and targeted campaigns to get people to run more, walk more, et cetera, et cetera, et cetera, to help and like stop eating so much junk, right? But that's the elephant in the room, and we're saying, oh, we're not looking at that. We're going to figure out every other way we can to make people healthy besides that one thing, which has been shown in all the other countries to work really effectively, really cheap, right? So, okay, throughout this, I've talked a lot about like a lot of problems, right? Talked about like design, talked about like all these issues, right? So what is a solution? Right now, Americans consume way below the recommended amounts of fiber, right? And so I think that really what we need to have is we need to have doctors who are more well-informed and doctors who have a lot more personal relationships with people, because what you're seeing now is you're seeing a culture of kind of this intense compartmentalization of the body as well. The idea that I can give you a pill that will fix one problem in your body, and if another problem arises, I'll give you another pill to fix that other problem. And we don't see the person as a holistic person, because this causes like all sorts of issues, because we know that like your mental health is affected by, let's say, your gut microbacteria, and gut microbacteria affects your mental health, and that affects your willingness to go exercise, and that affects what you eat. You might binge on some junk food now, and that's going to cause you to gain weight, and now you're going to look at yourself in the mirror, and you might not be happy with how you look, and that's going to cause like maybe depression. So you see how all this is actually intertwined. And so when we try to isolate just like one thing, it's really impossible, and it's making the problem so much more complicated than it needs to be. So really what I would advocate for is having doctors armed with a lot of correct knowledge, right, on what actually would make people healthier, as well as correct incentives. Like, so let's say as a doctor, right, if you're setting up a system, let's say you're going to open your own practice, right, and it's going to be like a health clinic, nutrition, just longevity, like get people to live longer, whatever. How would you set up the incentives to make sure that you yourself are being incentivized to keep people healthy? You do a monthly recurring membership, just like gyms, right? So that's actually why it's funny, because some gyms are trying to discourage people from going, or they're trying to find the people who will sign up for a gym membership and not actually go, because that makes them more money. In this case, I'm trying to make everybody as healthy so that they don't come and see me, because then they just pay their money and then I'm good, right? And I don't need to see them. I don't have any cost for that. And so in that case, right, I would start thinking about like, okay, how can I prevent any diseases before they actually occur? And I would be looking for the cheapest way to do that. And the cheapest way to do that is to tell them, hey, behavioral changes, diet changes, lifestyle changes, and I can work with them more one-on-one in a more personal manner to make sure that these changes actually stick, right? Give them recommendations, follow through on everything, right? This is a big issue with medicine, is currently like you go to the hospital for a problem, you see a doctor, that may not be the doctor you see next time. And so all of a sudden you're just re-explaining your context over and over again to a bunch of different people, and these people are not putting together all the pieces for you. And so now you have this really disjointed view of like how health works. And again, the one body is like one body, right? You're affected by something in your mind, it's going to affect your body as well. And so we need to put that connection together, because that's the only resource efficient and money efficient way to actually solve this problem in the long term. So I think that's like one of the biggest things. Another big thing I think is diet, and having an understanding that, what sticks for somebody is the most important thing. It's actually not like, oh, did you eat this certain vegetable? And we need to understand that behavioral changes take time, they need support, and it's not going to be a one quick fix. Like diets, just like these fads, this idea, this is why everybody's hyper-fixated on very specific oils and things that they should or should not eat. You're eating too much of this. Well, what if we make a very non-controversial statement that's very easy for people, they don't get confused? Eat less things in packages. Okay, well, what things are not in packages? Pretty much all produce, right? Like all the things in packages, right, tend to be more unhealthy, right? Even like some packaged salad kits can be a little bit like less healthy than just eating, let's say, a whole piece of fruit. And then by doing that, I think we can use that as a starting point to just make things simpler and focus more not on what are people supposed to be eating, but actually how can we get them to stick to eating this? And I think that if we do that, that'll move things in a better direction. But what we're seeing now is just like throughout the whole thing I've described thus far is that there's no incentive for people to make things cheaper, really. We started seeing a little bit with hospitals just because they wanted to lower their costs. But otherwise, the government doesn't have an incentive to make things cheaper because they just have infinite money, right? They just keep borrowing it. So like that doesn't really do anything. And then again, the consumer themselves doesn't have a lot of power. We talked about how the doctors don't have a lot of power. And then it's just at the mercy of the drug companies and insurance companies, which is not too great. So really, I think it's important to understand like what is all going on, right? How these different players have incentives and how this creates the space that we operate in, and how this is going a certain direction away from the direction we want to go, and how we can try to correct this. Of course, it's not going to be easy. Of course, it's going to be difficult, but I think it's important, eye-opening to kind of consider these perspectives. That's all I have for this one. If you have any comments as to what other stuff you want me to do a video on, please leave that below. Subscribe for more, and I'll see you in the next video.